Welcome back. The average daily pace of COVID-19 vaccinations in the U.S. is down almost 50% from its April peak. And that means that viable vaccines are going unused and expiring, just as places like India and Brazil scramble to get their citizens vaccinated. Joining us now to talk about that and more is Dr. Shereef Elnahal, CEO at University Hospital and former New Jersey Department of Health Commissioner. Dr. Elnahal, good to see you. Let's start with those expiring vaccines. What does that mean for our overall fight against COVID-19?
Well, thank you so much for having me. I think it's really a shame if we allow large volumes of vaccines to expire, especially as you mentioned. You have many parts of the world with incredibly disturbing surges that pose a risk not only domestically in those countries, but also in this country with all the international travel that's just getting more and more voluminous in recent weeks as we all make progress towards the end of the pandemic. And so I think we really have to do all of our parts in increasing vaccine confidence in our own communities. And every leader in this country of every stripe should be talking to their colleagues, to their coworkers, and to their employees and beyond about the importance of getting vaccinated as a civic duty, but also getting to where people are, especially in communities that have had a more difficult time accessing the vaccine. I do not think we are maximizing the extent to which we are providing vaccine to folks who are confident and want the vaccine, especially in urban communities and communities of color. And we've been very focused on that at University Hospital.
I'm curious to know, doctor, if you see vaccine hesitancy only increasing as we really get into these summer months, especially when we have these headlines, that a booster shot is going to be needed possibly as soon as September. Just anecdotally, I was talking to one of my older relatives and they said, yeah, why would I bother go to get the vaccine now if I would need to go get another shot in a couple of months? I'm just going to wait until they've figured this whole thing out. And I won't have to keep coming back to get those booster shots. How can we convince people that this is something that they need to do? I'm asking because I would love the argument to give to my own family members that are hesitant.
No, understood. And I think we're all having these conversations now, so hopefully I can help here. We have a situation where there are still people who have not been vaccinated and still want to. So that's, I think, the first segment of folks to focus on. But it's not that hesitancy is increasing. I think a large part of the issue is folks know the vaccines work. They're okay with the vaccines in concept, but they're just not as motivated to go get the vaccine because they don't think COVID-19 is a real risk to them. And so I think clarifying the facts on that, explaining that COVID-19 is a risk to you, no matter what your age and what your comorbidities are, is important. We've had folks as young as in their 20s and 30s get things like strokes and long hauler syndrome and otherwise bad outcomes with COVID-19 who are at that age and even younger. And so I think it's important to emphasize that. The question around the booster is one about effectiveness. So if you found out that your antibodies would only last 6 months, what was the point of you taking those first 2 shots back when you first took them? I think most folks, if they hear the explanation about why a booster may be needed, and still the jury's out on that, by the way, the FDA has to look at that issue and the evidence has to be publicly scrutinized. But if in fact immunity is proven to wane after as short a time as 6, 8, 10 months, then yes, a booster will be needed. And I think there's a lot of confidence being expressed by both Moderna and Pfizer executives that they're seeing data that supports that. So all of that remains to be seen. But if a booster is needed, we will be trumpeting the importance of that and explaining it to as many people as possible.
Doctor, I know that you recently testified at a hearing with the Senate's Homeland Security Committee about what went wrong during the pandemic. What will hospitals need for the next time? I know we're smack in the middle of this one now. We don't want to think about the next time, but we have to. What are some of the lessons learned and some of the big takeaways we should be having or taking with us for the next time?
Yeah, it was really an honor to testify before that hearing. I want to thank the committee for bringing forward such an important issue. I mean, we were in a dire situation just last March and April in a country that is the richest in the world, where we couldn't get basic supplies for healthcare, including the critical medications that are needed to keep somebody on a ventilator. And so I expressed our experiences as clearly as possible, not just on medications, but on critical supplies like N95 masks, and really advocated for some policies that would shore up the availability of supplies and make the incentives much greater and make it easier for hospitals, even those with thin margins, to be able to keep 60, 90 days worth of PPE to prepare for the next pandemic. And so I do think the Biden administration has taken some really important steps, including really maximizing the use of the Defense Production Act and really making a strategy for the Defense Production Act over the next several years. All of that is going to be very important, but I don't think we're there yet in terms of being prepared for the next pandemic. And it's going to be all hands on deck, not just from the government, but from the private sector as well, working with government to create the incentives and the right environment to make sure we don't run out of these critical supplies again.
Well, hopefully a new pandemic doesn't strike us anytime soon. It's a little bit worrying to hear you say you don't think we're exactly prepared for another one when it hits. One last question for you here, Doctor. Just yesterday, Alexis and I were chatting with Dr. Owais Durrani, and he said that he envisions the future in which we have a case of two cities, a tale of two cities, where vaccinated folks are participating in some activities with each other, being able to go to events with each other, and non-vaccinated people will have to be sequestered into their own section, whether it's at a baseball game or a concert, perhaps. Are you also envisioning it the same way that states are going to be forced and businesses and event venues are going to be forced to create these vaccinated, unvaccinated sections to allow the economies to reopen?
I think that is certainly a risk. And, I know that the concept of vaccine passports have been controversial, but there are other ways that businesses and governments can try to verify if folks are vaccinated. And so I think that may be the reality. You don't want to be in a situation where you can't do what you think you want or need to do in life because you're vaccinated or not. I think the evidence is overwhelming, though, that these vaccines are safe and effective. And so as we proceed through time and you get full FDA approval of the 3 vaccines now and potentially more down the road, you're going to see more movements toward this. And so I think it's, again, on all of us to make sure that we express the safety and effectiveness of each of the vaccines, including Johnson & Johnson. We're concerned that some of our stock on that is going to expire because about 80% or more are denying it and seeking the other vaccines. I think it's important for all of us to emphasize the safety, in particular, of that vaccine, knowing that the FDA and the CDC looked into this and made clear that the benefits far outweigh the risks of taking Johnson & Johnson and the other 2 vaccines. And so the more that every leader and every person does what they can to encourage vaccination, the less likely we'll see this situation where unvaccinated people are treated as second-class citizens. I think the fewer unvaccinated people we have, the safer we will all be. And I think that's the goal we should all shoot for.